Welcome back to Ladies of Another View, and I want to welcome back our guest, Mark Mostert, who is a senior researcher with Able Americans, which is a program for the National Center of Public Policy Research. Welcome back, Mark.
Thank you very much. Very impressive commanding all those acronyms and names. You got it right. Thanks so much.
I was thinking that same.
It's because I've been doing this for a while. I've been getting some great guests from the National Center. And I want to point out to people, if they want to learn about Able Americans, there's a lot of programs that we've been talking about. Go to nationalcenter.org. It's at the bottom of your screen, and you'll go to click on Able Americans, right? That's the tab?
That's correct.
Right, and you can see more of some of what Tony has written. What am I saying? Mark. Tony was our previous guest, which Mark has written. And you have written recently, I want to get back into this fraud and waste, because what have you been uncovering?
Well, again, we go back to this idea of bureaucracies, and I think that's a general thrust of the whole National Center. And that is to have a look at policies within the government that don't work, which ones do, and to do more of the ones that work and fewer of the ones that don't. That's a massive, massive undertaking, as you would expect, across the federal government. And we started our Project Access that developed the website. We looked just at, as I said, Health and Human Services, Medicare, Medicaid. And it took us close to 18 months to extract the data that we were able to put on the website. That's working with a 5-person research team. And one of the things that came up again and again and again was this idea of massive fraud and massive waste within HHS and Medicare and Medicaid. We're talking in the billions of dollars. We're not talking, a tiny little amount of money. We're talking about hefty sums of taxpayer money that seemingly disappears. Now, these federal agencies do have entities that try to track fraud and abuse, and they do indeed go after people sometimes, and not very often. And what that means is that a good portion of the people that are either committing fraud or waste get away with it. The bureaucracy is so large, it's just not possible to track down all the money. So every year, it's basically like pouring water into a bucket that's got a bunch of holes in it. That money just disappears, and we don't quite know where to find it.
I want to look at these numbers. Something I took from your article. I want to put up on the screen and just read from it. In 2020, articles in the American Journal of Public Health classified 6 categories of waste in healthcare spending: clinical inefficiencies, missed prevention opportunities, overuse, administrative waste, excessive prices, and fraud/abuse. Across all categories, it was estimated that annual waste was between 600 billion and 1.9 trillion. I mean, by the time you get to that point, how much can you add up and get there? You know, you're just rounding up there from a billion or a trillion, but that is a huge amount of waste we're talking about.
That is, and when you look at these entities that try to recover some of that money or actually prosecute people for fraud, they're recovering, $200,000 here, $1.6 million there. And that's great that they are, no question. But most of it goes unchallenged, as it were. And this is not only in the federal government. This applies to all bureaucratic entities. I spent some time years ago advising on disability issues at the UN and became very familiar with how the UN works. And how the UN works basically is it doesn't. That's how it works, okay? Another example of bureaucracies that are so enmeshed, that are so entrenched, that have so many turf wars, that have so much money pouring in that they have the same amount of fraud and abuse. And what happens is all the money that is needed, for example, for people with disabilities around the world that really need services, programs, resources, the money ends up very rarely getting to them. It all just kind of disappears into the bureaucracy. So that's why we need to question this whole idea of quote unquote official sources of doling out money, because the potential for fraud and abuse is so great. Unless we can deal with that, we might have to come up with some alternative about how we provide people with disabilities here and worldwide with what they need. They're not getting it currently, despite all the money we're spending or wasting.
Well, that kind of leads us into, you kind of talked about the World Health Organization. That just leads right into it. Talk more about how the fraud is all engulfed
anything,
in that.
the World Health Organization, any UN entity that you would care to think about, it's the same. People have good ideas. So, for example, I might go to the UN and be able to float a really good idea about, say, we need to get, I'm just postulating here, we need 100,000 wheelchairs in Kenya, okay? Not a big deal. Find 100,000 wheelchairs, write the check and get them to the people who need it. It seems so simple. However, if you then take that idea and go through every level of bureaucracy, whether it's federally or at the UN or the World Health Organization or the National Institutes for Health, whatever else, okay, that gets so watered down that by the time there is action taken by the bureaucracy to buy wheelchairs for Kenya, it ends up a boondoggle, okay? Well, we wanted 100,000 wheelchairs, we only have money for 25. Or the opposite, hey, we could have bought 400,000 because we found this money we didn't know we had. So there's very little at the end game where people on the ground with disabilities absolutely need, for example, wheelchairs. The chances of them getting that after all of these bureaucracies have had their hands in the pot are very little to none. They've at least vastly watered down and inefficient.
Well, it's a little bit disheartening, when you think about it. And there were so many things that happened where our government had us maybe looking the other way. Did any of this get exacerbated by COVID?
Yes. What we did, of course, with COVID was we printed trillions of dollars, paid it to people who were working at home or not working. And then, as we know from multiple reports, the amount of fraud with the COVID funds was just incredible. I mean, again, billions and billions of dollars that were siphoned off by people who shouldn't have gotten the money, people siphoning off hundreds of thousands, millions of dollars, splurging on properties, on cars, on overseas trips. And there's been virtually no accountability for the COVID fraud at all. The government talks a big game about that. Yes, we have to look into it. We're going to set up a committee or an inquiry or, an independent investigation. But quite frankly, at the end of the day, because it's a bureaucracy, someone will make a recommendation somewhere, it'll be put in a file, it'll collect dust on a desk, and the money, our hard-earned taxpayer money, is gone, never to return.
To not realize we are like a third world country is to have your head in the sand, because we're so inefficient. Mm-hmm. I'll just share that I was in a hospital in Spain last year, and I still haven't been reimbursed, and I've billed twice. And I called somebody. My husband and I were on the speakerphone talking to somebody at the Medicare headquarters, and I wish I would have recorded it. He's like, "Oh, this is so screwed up. This system is so messed up." Well, because they never even acknowledged receiving it. He can't call to find out. Like, do you have it? You can't track it. He said, I would just recommend making a copy, rebilling them. We still haven't heard anything. It's been over a year.
Gosh.
And I mean, we are not being helped by our government. That's for sure.
That's correct. And I think that's the big take. We're not being helped. And your example, your experience is exactly what hundreds of thousands and millions of people with disabilities have to put up with. Now, yours, I don't know the details, but it sounded like a one-off and things turned out fine. And I'm really glad to hear that. But people with disabilities live with this lifelong. And living with it lifelong, you have to have the services in place. You have to plan ahead with those services. You have to plan ahead in your life to accommodate your disability. And that is not happening. So taking your story for someone with, a debilitating disability they've had all their life, you could only imagine the frustration that you had, multiply that 1,000 times, and that's what they live with on a daily basis.
Unbelievable.
Well, and it's the thing about, you can't just call one person, because everybody's always like, oh, I don't deal with that. I don't deal with that. I might deal with the wheelchair, but I don't deal with the automatic door openers. It just goes on. Well, that's somebody else. That's somebody else. No one takes accountability. No one can give you a number. No one can give you a website. It just goes on and on.
They can't check anything up?
No.
It's like, oh, I can't check it up. There's nothing I can do. There's no number I can call. Okay, with less than a minute here, is there going to be a solution? Is anybody fighting to improve this besides you, Mark?
Yeah. Me and the National Center together, I think, we have developed a policy paper looking at several different aspects of people with disabilities and their lives. For example, medical bias, travel on airplanes and public transportation is another big thing. And what we've done is we've gone through these separate categories and we've come up with solutions in each category. For example, people in wheelchairs really have a horrible time getting on and off airplanes. We have recommendations. This is what should happen. We need more training. We need better wheelchairs. We need the airlines to step up. We're providing serious and we can't get into it obviously, but serious recommendations across each of those lifestyle kinds of things that people with disabilities experience every day. And what we're going to do is take those to Capitol Hill, and in preparation for the new administration, whoever that is, to get this in the interest of some senators, some staffers, so that we can then start to generate some policy interest and then hopefully change some laws to make things easier for people with disabilities.
Oh, I hope so. You are so sensible, and we need to cut through all this stuff. So thank you, Mark, for your good work, and stay in touch with us. We'll have you on again.
My pleasure. Have a good day. Thank you.
Thanks.
Thank you as well.